First, let me express my sincere thanks to the organizers for having invited me to this program and having given me a chance to share my thoughts on this disease with this audience. I also feel happy to be here because I see a lot of faces which are familiar to me among the audience. Another reason is that there are a lot of senior physicians sitting in front of me. Many of them I know personally. Many of them are expert physicians. In front of them only I am trying to say what I know about Vadarakta. So I am well aware of the capacity of the audience as clinicians. And I also feel that what I am going to talk here may be familiar to a lot of doctors sitting here because they were my students years back. So those people may please bear with me. Others, if they feel that this is in some way useful to you, please accept and try to improvise your clinical profile. Before entering the subject, one more thing I would like to say. Our field is not just like modern medicine. I don't want to compare this with another system. I just want to speak out what our field is actually. We have different requirements in Ayurvedic field. From the angle of a researcher, you have to formulate. From the angle of academician, you have to formulate. From the angle of most probably an administrative person, we have to evolve our requirements in Ayurveda. Then lastly, or most importantly, as a clinician, what is the level of knowledge you require in Ayurveda? The modern science and all these things are well coordinated, or more coordinated than our field. So it becomes easier to convey the knowledges required by each of these categories and easily get accepted throughout the world. And they go in for more the way of the physical science to document, to teach in all aspects, so that you get a better acceptance in the first site itself. Our problems in making these requirements uniform is starting from the academic level itself. We have not formulated a uniformity in teaching this Ayurvedic course, making a uniform pattern for the practitioners, making a uniform pattern for the research methodologies, and so on. So what happens ultimately is we are left with no other option but just to copy down what they are doing. So that is accepted worldwide. Whether it is in a right way or wrong way, that's a different issue, but it has got a more wider acceptance. So we just copy down all those methodologies from the modern science. Here, I just try to present my views on arthritis, which will be more suitable to the practicing community than any other group. When I was invited to talk about this, I asked what could be the better option from the angle of audience, not from my angle. So I was told that the clinicians, most of the practitioners are attending the meeting. So I suggested that most probably they will welcome only if there is some element of conviction as far as the practice is concerned. So just try to make it from purely an Ayurvedic angle. I don't want to touch upon this modern angle, not because I'm not familiar with that. I was a teacher of anatomy for 20 years, so I have a touch of modern science as well. I just try to make it purely Ayurvedic. For example, if Suppose we are practicing this system maybe 200 years back, and maybe you are practicing this system in an area where no other facility is available, and you are bound to show the results under some threat. Suppose you are left with no other option, you have to create it. So most of us will do it, I'm sure, because you have the stuff in you. Whether you have analyzed it or looked back or how far you have understood it, that is a different issue. Most of us have the stuff with us, the Shastra with us. How far we are utilizing it, there lies the most important aspects. So let me enter into the subject. My main question lingering in my mind is that how far we know about Vata-Pitta. Before entering into the subject, this is a major problem. You leave alone rheumatoid arthritis or gout arthritis or any kind of arthritis. As such, Vata Shonida, Vata-Pitta, how many of us are 100% confident that I know this disease? Answer lies with each of you. What I feel is, next. We know that it is a disease state which is explained towards the last part of this Nidana Sthanam and all, especially by Vagbhada. I would like to categorize the whole presentation into two aspects, because you are trying to understand the disease process and its treatment very effectively. Everybody wants to treat them very effectively and show the results. It will be effective only if you know that what is a disease in its own theory, in its own way. What is a disease? If the disease has to be known, first you must know this is a specific disease. For that clarity, you must know what is the disease process basically. The disease process is known basically, you understand what is the disease in specific. To know the disease process, you must understand what is the normalcy of the body in which the disease is expected. The normalcy of the body is known, then you can understand what are the changes happening in the disease process. Then only you can understand what are the changes happening in the disease process, because disease is a deviation from health. Normalcy. So you must know what is the normalcy of the body to understand the same specific disease. Thirdly, if you know what is the normalcy of the body as per Ayurveda, definitely it is based on three doshas. Everybody knows it is based on three doshas. If we have to understand what is three dosha, like what everybody is doing nowadays, I think no physics or chemistry based science will be helping to have a 100% conviction in the theory of Tridosha. This is what I have felt. We must have a conviction about Tridosha, provided you have a basic understanding of the philosophies based on which this concept is evolved. Not based on the science, especially the physical science. It is not based on the physical science, this theory of Tridosha is evolved. So just to get an understanding of these things, normalcy of the body, disease process, and Tridosha theory, and introduction to Tridosha theory, we must have a slightly different outlook from the existing modern contemporary science, so that your effort to understand the disease, its pathogenesis, this is only a term, nama matra. Pathogenesis is the real understanding of the disease. Once you know the pathogenesis very clearly in terms of Ayurveda, you are left with many options to work in that area. It's not a question of that medicine, this medicine. Just like previous speaker said, it is only herbal. We talk about Ayurveda, then it is a question of how you work in that atmosphere to knowingly create a change to the benefit of the patient. It's not just giving a medicine and leaving him in the dark. You are knowingly doing a work on the patient so that effective changes are created in the atmosphere of the patient. That is what is known as chikitsa. So the whole event becomes knowledgeable. Giving one medicine and expecting results, sometimes it works, sometimes it doesn't work. Somebody asks you to explain, especially when the system is taken to the Western countries, you are expected to explain things in more clearer picture. So giving a medicine expecting a wonderful result is just, I think it is foolishness. We are not able to convey this matter to a third person who doesn't know anything about Ayurveda. So this is the requirement. Let me enter into that. Next. I'm not trying to make it spiritual. Please bear with me again. I used to say that the entire Ayurveda is a Shastra developed in India. Definitely it must be based on the Indian thought process in the olden ages. It's not based on a system that is developed in Europe, which is based on the physical sciences like physics, chemistry and all. So this is a system developed in India, and all the Shastras developed in India will have a common line of thinking, common methodology of thought process. That is what you say Indian thought process, which is based on Vedic knowledge and Upanishad and philosophy. No, I don't want you to become a philosopher. Just for a reference, I'm just putting it. The absolute truthful nature of this world is explained in Vedas in a very crude way. Say everything, essence is one. Which is further explained to have a direct experience of what is the truth. That explanation happens in Upanishad. And since we are living in this phenomenal physical world, those truthful status has to be further explained in the phenomenal context. That is what is done by philosophy. So I think there is an absolute subtle state of Vedic knowledge which is explained little more clearly in the Upanishads to have a direct experience of that, and that without contradicting that explanation, this world, what is seen around you, the phenomenal world, is explained in philosophy. Basically, this has been accepted as a methodology of science, methodology of Shastra in Ayurveda. What I wanted to say is, you have the phenomenal world explained in the philosophy, what is seen around you, but its metaphysical stage is further explained in the Upanishads. Still the higher status, the real stage, is explained in Vedas. You accept the fact that there are three planes existing for anything which is living. So what happens is that you have a method of expanding this base reality into a manifold level as and when required. If you don't want that, if you want to know the absolute status, same time you can comprehend and reduce to the base level where you can interact with freely. If you want a total knowledge of what is happening, you can bring it down. If you want to expand it, you can expand it infinitely. That methodology of comprehension and deduction and expansion, which is very similar to mathematics. We do it in mathematics. Like when we go first time to moon, you don't know the distance, but you calculate in your smaller parameters. Later you expand and you get an accurate precision in finding out the exact distance to the moon. So mathematics, we are doing that expansion and comprehension. A plus b whole square is equal to a square plus 2ab plus b square. You reduce it to your level so that easily it can be conveyed. You can deal with it, and whenever you want an expansion, you can do it. So the method of expansion and comprehension is the methodology we have adopted from this Vedic understanding. This very clearly you can see as far as the individual is concerned. Ayurveda is not just a medical science, as everybody know. It is a science of whole life. Whatever is required for an individual in a healthy status or a disease status, what is required for the whole plane of the individual is described. Even in Jara, we know that Karunardram Manas Shuddham Sarva Jara Vinashanam. We say Manas is clear, that is a complete relief of Jara. It's not medicine. So when we do something, when we talk about a disease as cure, it is a total, perfect, 100% cure. For the physical plane, metaphysical, mental plane, and the effect goes to the spiritual person, the person, whom you call it as the person. So this atmosphere of understanding, the method of understanding the individual, we agree that everybody has a physical body, functionally, which is nothing but 5 sense organs, with which you are interacting with the world. Beyond this physical plane, it is a metaphysical mental plane, which is involved in all activities of your sense organs. And beyond that, there is an owner who is manipulating the mental plane and physical plane in any of your activities. This is much evident when we describe what is happening in the deep sleep. Gada Nidra. When you have the body totally under rest, mind is not operating, and in the morning you get up and you say that I had a good sleep. The question arises, how did you know that? Mind was resting, body was resting, not functioning. Still you had a knowledge created. So it clearly indicates that the knowledge or experience is happening in a faculty which is something different from the mental plane and the physical plane. So we agree with that an individual comprises a physical plane, a mental, metaphysical mental plane, and a spiritual plane. And ultimately the benefit of the treatment goes to that spiritual plane also. So when we deal with the diseases, we have to deal with the physical plane and mental plane very, very clearly. In any kind of disease. Even in the description of Jara, Purva Rupa, we see that irritability is the major symptom as per our description. So I just wanted to say that anytime you can expand and comprehend, this method of expansion and comprehension, whenever things are multidimensional, complex, or rather confusing, you have a possibility of reducing it to your level and then work on that level. Whenever it is needed, you can expand and show it to the unlimited levels. Okay? Next. So I just wanted to say how this theory of Tridosha has been evolved. Okay. So as an individual, your physical parameters, physical faculties are 5 sense organs to interact with the outer world, to know anything in the outer world. Knowledge is experience. So when you try to know what is this body, what is this disease, what is this world made up of, your physical faculties are limited to 5 sense organs. Okay, 5 sense organs, through the 5 sense organs, with the help of mind, you are looking out to the world and trying to see what is it made up of. So you have only 5 functional outlets to gather information about the whole world. So each of the information you collect through these 5 outlets will be of 5 varieties of information gathered, and it cannot be 6 varieties. Fundamentally, basically, it can be of 5 varieties information collected about the constituent elements of the universe. That is how the theory of Panchabhuta concept has come. That you cannot change as long as this theory is existing in India. As long as this Vedic methodology is existing, you cannot make it 4 Buddhas or 6 Buddhas. It will be always 5 Buddhas, as long as you are looking at the world through this prism. Okay, so 5 Buddhas are nothing but the structural concept of the whole universe. I say structural concept of the whole universe. So in a functional body, we know that everything is changing. Every second everything is changing. According to our science, according to modern science, everything is changing every second. We say Chiyade Anenegi Shariram. Every second it is changing. Towards a decay it is changing. So in a live body, functional body, these 5 elements are remaining in the combined form. They are not independent, they are remaining in the combined form, in which we say that Prithvi and Jala make up the gross structure, Vayu or Akasha make up the subtle part, and Agni remains in between with the Jala. This is the concept of Panchabhuta in the functional body. Okay. So in that aspect, you see that the gross structure, what you see, is definitely dominant with Prithvi and Jala, and subtle part is with Vayu and Akasha. Agni is remaining in between. So thing is that what you understand from the structure. Structure is only a name. We know that Dravyam, Gunam and Karmam. Dravyam is for name. What you understand from the Dravya is the properties reflected by the Dravya, which is nothing but the Guna. So what you interact, what you try to understand is the properties of the matter, and matter is named always. So structural understanding is almost like the Dravya. What the structure reflects, we are trying to understand, and that is nothing but the Guna. Properties reflected by these structural entities, we call it as Gunas. So if the structure is Panchamahabhuta and gross bodies Prithvi and Jala in the combined form, they reflect certain properties for which you name as Shleshma, Kapha. The structure reflects the properties which are subjected to continuous change. It is added according to what you eat. It is reduced according to the transformations or utilizations. So every second it is added and deleted. So we are concerned with how far this transformation is smoothly taking place. Whatever be the structure maintained, we are concerned with this transformation, which is a functional aspect, and we are always looking to that functional aspect of this structure. That's why an anatomical description is almost reduced in Ayurvedic understanding, whereas the functional descriptions are very, very elaborate. I think this theory now goes in line with the modern understanding of structural functionality concept in neurology, at least started recently. Structural understanding is not sufficient to describe most of the diseases in neurology. So they gradually try to understand diseases from the functional aspect, at least in neurology. So we always are looking for the functional changes in the body whenever we describe the body, not at the structural changes. So when you say the body is Kapha, the gross structure is Kapha, the properties reflected by Prithvi and Jala, and it reflects the properties of basically Snigdha and Sida nature. And you require a minimum level of Ushna, heat, to maintain the minimum Sida nature. It's not absolute Sida. Minimum Sida nature maintained with the presence of minimum Ushna, which comes from the Agni concept. So these three aspects form the structure. What you say the body, three aspects form the structure in which the movement of Vayu is smoothly taking place through the space provided by Agasham, inherent space. I say the matter bound space is not absolute space. Nobody will agree with absolute space being a part of the matter. It is a matter bound space through which Vayu is moving to conduct different functions of the body. So any activity is a movement, one dhatu to another. If you are transforming, that is basically a movement. And growth is an expansive movement. Any of your activity is a movement which we attribute to the Vayu. That is possible provided you have a smooth, healthy structure of Snigdha, Sida and Agneya properties. So if you just look at the structure alone, we have to say that it is nothing but Shleshma related atmosphere, and part of the Agni is related with Pitta, which provides an atmosphere for Vayu movement in a smooth way. This is what is known as the normalcy of the body, normalcy of the physical plane. When we say Prakriti, this is a normalcy of the physical plane alone. Okay? So Snigdha, Sida and Agneya is atmosphere required so that the Vayu movement is very, very smooth. This is what is known as physical Prakriti. In this atmosphere, you are visualizing what is happening in a disease. So this is a normalcy of the structure you are calculating, and in this atmosphere we understand how this atmosphere is destroyed or destabilized to have a functional weakness. So Snigdha, we come to the calculation of Snigdha or Luksha, I told through the comprehension. If you just look at the Panchabhuta concept, one side there is a gross part, it is nothing but Prithvi and Jala or Shleshma, other side is subtle part. Naturally they are opposite, whatever properties are attributed to this Prithvi and Jala or Shleshma, you can reduce it and maximum you will come to Snigdha aspect. Other side, if you just reduce it, it will come to the Ruksha nature. You can have basically two properties. Everything will be a combinations and permutations of these two properties. So whenever you need it, you can expand. Whenever you need it, you can reduce to this base level. You can work with these two properties basically. That's why in Chikitsa and all we say that either Snehanam or Rukshanam or Swedanam or Stambanam is over, then you go to Raktamosham. Morning Sir was telling. We say basically four things. Snigdha, Ruksha Prayogam, Sida, Ushna Prayogam is over, then there is no scope. Then you go for Raktamosham. Take out a Dhatu to have a balanced dosha status in the body. So basically this four aspect, any level you can reduce so that your work with, you can work easily with the status of the body to make an effective change. So that reduction, you see that either Snigdha or Ruksha nature, both should coexist in a temporary world, and any changes are associated with either Ushna or Sida nature, like what we say exothermic or endothermic reactions, any chemistry. Basically it must be exothermic or endothermic. We say Sida or Ushna nature is there in any change, and basically the stuff is either Snigdha or Ruksha. Okay, what we require is a balance of all these things. Fine. So Snigdha and Sida nature is the basic health, or we say physical prakriti, and a total change from the Snigdha Sida nature to a Ushna Ruksha nature. A total opposite atmosphere is only imaginary, and it is a total destruction to the health. So that is not generally possible, or any dravya having those properties of Ushna Ruksha will be contraindicated in Ayurveda. Like Visham typically or Madhyam having this Ushna Ruksha nature, because we visualize that it will be totally damaging the structure. Or even Trigadu, which has got Ushna Ruksha nature, will be promoted in support of these Mudra Dravyas like milk or ghee or any other sugar, whatever Mudra Dravyas are there. Along with that, only Ushna Ruksha Dravyas are induced in little. So this concept of Snigdha, Sida and Agneya is getting disturbed basically in any disease. Snigdha stuff is almost like ghee, we say, neither liquid nor solid. This is getting destabilized with the disease process. Or disease process is rather a process to disturb this normalcy from Snigdha, Sida nature to gradually a Ushna Ruksha nature. Or aging is a process in which you see that the Snigdha Sida nature is naturally transforming into Ushna Ruksha dominant nature. Since aging is Satmyam, we are not reacting sharply, whereas disease is Asatmyam, you are reacting sharply to resist the change. This, in one context, even we say that aging is also a disease, Jara, Vyadhi. So reason is that from the Snigdha Sida nature, an opposite Ushna Ruksha nature is gradually established when the structure is systematically damaged. Any change in the universe also can be comprehended in the same way, like the principle of Srishti Sthiti Samharam, we calculate in, we understand in spiritual and all. A formation, a creation, maintenance and destruction. Bodies having the same understanding, bodies formulated and increase in size, then maintained and then gradually going down even though there is no disease. So that process is totally comprehended, and then we say the increase in size is nothing but Prithvi and Jala, because that is a gross part. So naturally it is dominant with Kapha properties. Maintenance, Kapha properties are maintained with the help of Pitta. Then going down means the Kapha properties are reduced or the opposite properties are increased, aging. This is how the concept of Kapha, Pitta, Vata has come into existence. So disease is a process in which there is a gradual transformation of the normal Snigdha Sida nature into Snigdha Ushna first and then Ushna Ruksha. Ushna is increased, so the Sida gradually goes down. Then Ushna is dominated, then the Snigdha starts melting. that is continued for some time, then the snigdha content in the dhadus will be reduced, or rather the dhadus become ruksha dominant. That is a weak status for the dhadus, which will have functional impairment at all levels. You call it as disease.
Can you add one more thing? That is why this Grita is as the best thing for Vartaki.
Yeah, Kridam is having all these systemic properties like Snigdha, Shida and Agneya nature. Snigdha, Shida is well taken into the body, then Grita shows its Agni content. Only when it is digested well, then it becomes Deepanam. If it is not digested well, it cannot be Deepanam. That's why in Grahani Chikitsa we say Snehameva Param Vidya Durbala Anala Deepanam. But in practice, nobody will be giving ghee as an initial medicine. You can't give it. Once you make an increase of Agni, stabilize the Agni, then ghee is the best thing to continue, so that Agni is stabilized for a longer time. So it has got Snigdha Shida properties. It's not Ushna. At the same time, it is Deepanam. That means Prithvi and Jala are contributed in proper proportion. Once it is taken, then it is prominent for Agni. So it is known as Deepanam as well. Otherwise, Snigdha, Shida properties or Dravyas having these properties will be generally Stambanam. It will not be Deepanam. Ghee is an exception, gold is an exception. That's why these two are considered as the best things, best Dravyas in Ayurveda. So the concept is that you see that all Chikitsas, major Chikitsas of especially Ashtanga, everywhere, Charaga also you see that towards the last part of the Chikitsa of each disease, you see that either a ghee preparation or a milk preparation to see that you are establishing the Snigdha Shida dominant Kapha structure in the body. Every treatment concludes with a ghee preparation. Even a Kapha dominant Pramekam, you are having Dhanudra Gridam. In a Pitta dominant Jala, you see that Pitulyadi Gridam is a medicine towards the last part. Whatever be the dosha, finally you are establishing the healthy status in the body, which is nothing but Shuddha Snigdhata, Shuddha Kapha, which is possible easily with either a ghee preparation or a milk preparation. So, reverse order, if you check, then what could be the healthy status? That's what exactly I am trying to say. Like mathematics, in reverse order, from the Chikitsa, from your experience, you look back and then confirm your theory. That's why this is mathematical. We are doing wonderful treatment. Only thing is that we are not evaluating this theory based on this treatment. So it is possible if milk is Shleshmalam, or still we say it is the best thing. Naturally Shleshmalam is the best thing. That is what Shastra says. So if body is not Shleshma, how can you say that this is the best thing? Ghee is best, milk is best. Rasayana is generally Snigdha Shida, it is best. That shows that body, stuff of the body, structure is Shleshma. And in that stuff you are having a disease to create a functional difficulty which lies with Vayu. Okay? Fine, next. So when you see that the Snigdha content of the body is destabilized through a process of heating, excess of induction of Ushna Dravyas beyond your requirement, that is induced, the Snigdha content is reduced, Shida content is reduced, and the Snigdha content is systematically melted to create weakness throughout the dhadus. Throughout the dhadus you get only the Snigdha as we understand, and when that is systematically destabilized, put to a melting position, liquefied position, through the induction of Ushna, this atmosphere is basically known as Jara in Ayurveda. This is a systematic calculation to destabilize the entire dhadus in the body through an induction of Ushna Dravyas. So Ushna Dravyas are induced and is gradually burning out the structure. Because of that you call it as Jara. It's almost like the process also we say it is Vidaham, result is Jwaranam. So it is almost equal to the concept of inflammation in the modern science, being the base nature of the disease process. We say Jwaram is a basic disease, and Jwaram can be expected as an Upadra Vyadhi in all diseases. We without this process of Ushna systematically destabilizing the Snigdha content, you cannot have a disease. So any disease you expect in different modes and different methods, different organs being affected, you name the disease differently. Basic process will be Jwara. So in Vata Rakta also you have to expect always the possibility of getting a fever very easily. It goes without telling that this process, basic process of damaging the structure is what is known as Jwara, and it is followed in all diseases. According to the system involved, parts involved, method you incur the disease, it is named differently. So basic disease process is from the natural state of Snigdha Shida, you are incurring an opposite atmosphere through the induction of Ushna. Just because Ushna is creating this destruction of the structure, you call it as burning. Just like the sun, what sun is doing to everything in the universe, this is also done by Agni, present in your body, maybe in a span of 100 years. That's all. That's the only difference. But it is systematically doing. In disease process, it is done in an earlier stage, which is not familiar to you, asatmyam. So when all the diseases process are creating weakness to the structure, when the structure is weak, maximum weakness is created, especially to the structures where the Vata is dominant. You get a major functional impairment, and that is known as Vata Vyadhi. So the process is again Jwara, but the weakness, resultant weakness is happening to the structures which are dominant with Vata, like Madhyama Roga Marga. Then you call it as Vata Vyadhi. So generally we say disease process is nothing but a progression of Jwara into Vata Vyadhi. Everywhere you are having weakness created to the structures in different aspects of the body. So all diseases you have to visualize the process of Jwara, and ultimately you see that maximum weakness is established in the most important Vata dominant areas. Then there is a major functional failure, you call it as Vata Vyadhi. Jwaram itself, we say that Sadhya symptoms, we say Sarva Sampurna Lakshanaha Jwaraha Syad Asadhyaha Vaigalyado Abiva. Maximum is a fatal fever. That is not happening. It will be giving a Vaigalya, means a Vata Vyadhi. Is resulted. That is maximum you can expect generally from this disease process. So basically, I would like to say that disease process is a progression of Jwara process, or from Jwara to Vata Vyadhi, where maximum weakness to the structure is established in the Vata prominent areas. Beyond this maximum weakness, what you can expect in any disease format is a weakness plus degeneration of the structure. First stage is weakness only, and weakness plus degeneration is established. That atmosphere is known as Vata Rakta. This is what is basically known as Vata Rakta. Maximum weakness you call it as Vata Vyadhi only. Up to that you have only 3 doshas involved. Kapha dominant structure with the help of Pitta getting disturbed so that the Vata functions are totally impaired. Beyond this aspect, what you expect is weakness plus a degeneration, a decay of that structure involved. Then it is known as Vata Rakta. So I don't want to say that Vata Rakta is neither rheumatoid arthritis nor any other disease. That's a different issue. Our understanding of the disease process is more comprehensive. Otherwise, we have to agree that we have only 25 major diseases. It's not like that. Modern science has got innumerable diseases. We have only 25. It is never on an equal platform. We are talking about the disease. Unfortunately, it is happening, but it's never on the equal platform. Understanding the body, understanding the disease, and subsequently working on a disease is also on a different parameter. This is what I feel. So Vata Rakta is a gross atmosphere in which you see that you have a maximum weakness created due to various factors for a long time, and in that weak atmosphere you are using something to provoke the Rakta Dhatu also, like Vidakyanam, Vidutancha. Such a person can easily get a degenerative atmosphere continuously staying in the body, and that is why the treatment of the disease becomes more difficult compared to any other disease. I require next put it. So let me turn into the treatment aspect. Line of treatment is Vada. Everybody knows what is the treatment. Vadasya Upakrama Sneha Sweda Samshodhanam Mrutu. Snigdha and Ushna Dravyas applied according to the yuti of the physician, according to the right context, right levels of Snigdha and Ushna Dravyas induced. We see that the Shida and Snigdha aspect is re-established. Fine. Snigdha induction is your basic requirement, and Ushna, minimum Ushna is required to avoid the weakness generated by any disease. When it comes to Vadarekta, you see that name Snigdha content has to be induced. That is what we are doing. But while applying the Ushna, you must be very much careful, because Ushna will be further vitiating the Rekta, further damaging the structure. So we have to be very careful based on the overall atmosphere of the patient, based on the Desha, Kala, etc., or based on the Prakriti of the patient. We will be very careful in inducing the Ushna content in a Vadarekta patient. So Snigdha and Anushna Siddha, and then Shodhana as a part of the total treatment. Shodhana, in which Vada, we know that Vasti is the best thing, whereas Vadarekta, you see that Shiravasti will be the best thing, because Shiram is good for Rekta as well. The process of Vasti is good for Vada, ingredient is good for Rekta. That's why we say Shiravasti is a better option for Vadarekta. Next. Little more why we see that, since we say the systems, entire systems are weak, that includes weakness to the Koshtam and Madhyama Roga Marga as well as Shaka. Since the Koshtam is weak, always you consider the Agni as the base point. Even you are inducing a Snigdha content, it has to be digested and then taken to the system. So we see that Agni has to be stabilized in all diseases. Since the Koshtam is weak, Agni related complications, base complications like Jara has to be visualized anywhere in Vadarekta. That is, if you see that a systematic ama or ajirna nature is seen, lack of appetite, whatever you take, you feel heavy, difficulty to digest and all, in a systematic atmosphere of Vadarekta, where the Kapha dominant ajirna nature is there, you calculate amam, jaram and shofam as a base symptoms, because all these symptoms are related with each other. Like Jara is a base disease according to Vagbada, Shofa is a base disease according to Charaga. Root causes are same, visualized from the Agni point. So if it is Kapha dominant atmosphere, generally practitioners will be using this Amrudotaram Kashayam type of things to digest out Ama and Jara. Then you will be treating the Vada atmosphere without provoking Rekta, like Rasnerandadi or Belaguluchya, the line of treatments according to the general requirement. In certain conditions like Pitta dominant Jara or overall atmosphere is present, to my experience, gout arthritis presents that kind of atmosphere, in which this Amrotra type of Kashaya cannot be utilized very easily. There you will have to resort to a Pitta dominant Jarahara treatment like Amrda Shadangam. Mostly I used to do it, or even for a limited time like Guruchya Kashayam, in which Pitta dominant Jara Ama nature is reduced. Then you will be treating the same Vadarekta with Sadaviryadi or Sadaviri Chiniruhadi or Kogilakshan type of Kashaya, not like Rasnerandadi or Belaguluchya. So you are visualizing Vada with an increased element of Pitta, with a lesser element of Pitta also. Accordingly, your medicines are gradually changing. Same disease, it is affecting the Madhyama Roga Marga. It can also affect the Tuk, just because Tuk is Vadasthana as well. If the flow of energy of the disease process is more concentrated towards the Tuk, even though it has an impact on the rest of the Dhadus, we call it as Uttanam. When this energy flow is more towards the internal structures, Madhyama Roga Marga, you call it as Gambhira Vadarekta. Most of the situations, sometimes medicines like Manjishtadi or Mahamanjishtadi or Gulgulu Tikta type of medicines can be utilized even if it is an typical arthritis, or even it has a nature of a skin disease, which has a backing of Vada and Rekta nature. This is what is generally seen among the physicians, how they categorize and make an effective result in the patients. It has got a strong backup of the theory where you are concerned with the use of external medicines. You can see that Pindadailam, Madhyashyadi, Bela Gulichadi, Shira Bela, Sahajaradi are some of the examples to see that the different grades of Ushna content. We know that Thailam is the medicine for Vayu. Pindadailam is typical. Ingredients are good for Pitta. Like that different. Shira Bela. We say Vadasrik Vadanashanam because preparation is good for Vayu. It is repeated with milk. So it becomes good for Vadarekta as well. You are treating Vayu. Only thing is that you are taking care of the Ushna content in that knowingly or unknowingly to create a change. Next one more. So Snehanam, Swedanam and Mrudu Shodhanam will be the overall line of treatment you are doing. That's very clear. Snehanam and Mrudu Swedanam. Application of heat is limited and Shodhana purpose